because I don't think I know when it started, but I know when I couldn't stand things anymore, and that was in the last 3 years. My doctor here, my new doctor, he diagnosed me with fibromyalgia kind of mid 2020, and I wasn't ready to accept that because the people in my family who have fibromyalgia have different lives, and so I thought maybe mine should look more like theirs, and it doesn't. So I just kept thinking maybe there's something else wrong. Maybe there's another reason for this pain or that pain. And he's like, well, no, all your pains line up with fibromyalgia. And I'm like, you mean even the brand new ones? How about the ones from when I was 5 years old? Do those line up? And he says, well, we don't really know when it starts. I don't really know when it starts. So if he doesn't know, I know I was diagnosed in 2020. I could have been born with it for all we know.
What did you mean by when you couldn't stand it all?
Pains. I get these feelings like I am bruised from my head to toe, mostly on the backs of my legs, in between my fingers. Um, I have this new thing that it's really what sent me to the doctor, where I have pain right there, just all in that squishy, tender, fleshy area in between the bones. And I didn't know if it was related to a thyroid or just a natural breast tissue thing. And the doctor said that it wasn't thyroid. I've been tested for my thyroid so many times. I'm convinced that if I was going to have a thyroid issue, they would have found it when I was 20 or 27 or 30 or 35. And now it's like they say it's fibromyalgia. And some of my days, it hurts so much to walk across my own house. I get too tired to take a shower. When I sit down on things, it causes pain because those phantom bruises, they feel real, even if it's just an incorrect brain signal telling my arm that it's bruised. Every time I touch it, just brushing up against myself, it would create so much discomfort and pain that I finally said, I want to be on drugs.
Like prescription medications? Just to
Yes,
clarify.
prescription medication that my doctor approves and has monitored for all of the legalness, um, therapeutic medication. It was from watching people that I'm related to go through fibromyalgia, the drugs that they were given are very much more like drugs and less like help. And so I put off everything I've been feeling my adult life because I don't want my doctor to diagnose me with something that puts me on those drugs. Seeing somebody wean themselves off of opiates that they've had to depend on for over 15 years because of a pain condition, it's it was sad seeing it. It was probably harder to go through it, and then to know once you're off of those things finally, there's nothing new that they can give you. You still have your pain condition, and now you have all the pain and no way to treat it. And I figured my life should go in a different direction if I can help it, but I don't know how these diseases work.
It's understandable to feel like a little lost and confused and not understand the diseases. I think a lot of the time doctors don't necessarily explain everything when it comes to a disease to the
No.
patient or what they should expect. It's kind of like, I have these symptoms, and they're like, okay, well, probably part of your disease. Sometimes they can like brush it off, like onto a current disease. It might actually be a different diagnosis, right? Like myself, I have chest pains. I have different kinds of chest pains, but one of them is caused by costochondritis, which is like the inflammation of that soft tissue in between your ribs. So if I'm having chest pain, I'll push on my chest and be like, oh yeah, it's that stuff in between my ribs that's causing the pain. I'm not having like a heart attack. It's the soft tissue on the outside. And if on the off chance, if I'm pushing there, which it hasn't happened to me yet, knock on wood, that if I push there and say there was no pain, then I would be concerned there's something internal going on. But knowing that's what that is, it took a bit of going through like different doctors to finally be like, have a doctor just push me there and be like, oh, it's costochondritis, you know?
Well, when they can just poke you and know the answer.
Yeah. It took a long time to get them to poke me. But it's also like, you got to do your due diligence as a patient to do the advocacy, which is also exhausting.
Yeah. Fibromyalgia needs its own advocacy right now as a community because we all have the same problem. Our diagnosis, the name for our diagnosis isn't even correct, but it is the one that we're running with.
So
Um,
so what is that then? What is the correct or the incorrect one?
we don't know because the way that diseases get named, if it's not named after the person who discovers it, it gets named after the complication it will cause or the pain related to the complication. So fibromyalgia is it's talking about your fibrous stuff, and a pain and mania-ish, no, not mania, but like, algia, the whole, we're forgetting our science words today. Thank you. Trying to sound smart. I'm dumb. The the root words for it don't line up. The only thing that really does line up is that you're getting a pain signal. So the thing that's causing it, it could be neurological. So if it is discovered to be neurological, then the fibro part, I'm looking at my post-it. The fibro part would get changed if it's found out to not be a direct muscular thing. And if it's a neurological thing, I don't know what they would name it or rename it to. And the myalgia part could change if any of the mechanics behind how that factored into how they wanted to name muscle pain disease. Because that's basically what fibromyalgia means in really wrong words. It means muscle pain disease. When I was in high school, I did a paper on it for those medical classes I was in, and I wanted to know more about it. So I did the paper, and in my research over 20 years ago, they thought it was potentially passed on through an alcoholic father at the time of conception, and that the whatever happens when you're drinking going into the DNA function of creating a human is what makes you potentially have fibromyalgia. And then they were not sure. So it was just in my possible theories in my summary. So as I get older, we find out, well, maybe it's something that you're born with and it's caused by a traumatic event. Maybe a car accident, maybe you fall and you break a bone, or maybe a very emotional traumatic event, because you can have physical responses to emotion. Maybe it's something, a big event that it starts it, and then all of a sudden you have fibromyalgia. And now we still don't know. I don't know what the new hot theory is. They're currently trying to find ways to test for it, to identify it in DNA or in blood or in anything that they can get off of your body that says, hey, everyone with fibromyalgia has this same genetic thing going on, a variation, mutation, the same blood count, just anything they can find that can connect us to each other to help identify it at least, so that everyone who has it, even if we have the wrong name for our diagnosis, then we can find treatment. Because if you find the cause, you can get to the treatment part and not just give somebody a bunch of Tramadol for half the rest of their life. Or right now I'm taking gabapentin and amitriptyline, but the amitriptyline is to help with headaches that I've had my whole life, but that's a fibromyalgia symptom, chronic headaches. I seriously could have been born with it, and my symptoms were small when I was small, and then they've grown with me as I've grown. Or maybe passing a certain age is what did it. Because I'm about the same age when the other people in my family started to not be able to handle it anymore, and they go to the doctor and they say, Doc, I hurt all the time. Can you help me? And it starts them on their diagnosis path. So maybe it's an age thing.
Yeah, it could be. It could be something that people are definitely born with. It's something that needs more research, that's for sure.
So much.
Thank you for sharing all of that. That was a plethora of information. I also wanted to just say, because you called yourself dumb, you're not dumb, just so you know.
Thank you. I'm not dumb.
You're
But I
not.
am pretty. I drop the words. I go, ooh, fun word, drop.
I think brain fog plays a big factor in that, because I know myself when I'm trying to articulate sometimes all of the wrong words come out and then I just get frustrated with myself. I just have to remember I'm dyslexic and I have brain fog, so it's okay.
In the fibro world, brain fog, we really do get that. I went on a 10-minute walk yesterday. I got so much fog after that. I was feeling good. I did a 10-minute walk. I'm going to message Ari. I'm going to see how she is. And it just all went. The energy to type.
I understand that. I'll be like, I'm gonna use my exercise bike for a bit and I'll use it and then I'll be like, all right, I'm feeling good. And then that like lull hits. I'm like, nope, I'm gonna have to lay down now and not interact with anyone. Because I have sent some pretty confusing messages in brain foggy states or even just low energy states. And then people are like, are you okay? Like, what does this mean? And I'll be like, I have no idea.
Well, with
So
the right friend, it's a fun mystery.
exactly. We'll both decipher these hieroglyphics that we've written to one another, mostly what I've written, but you know. So it sounds like it was quite a frustrating journey to get the diagnosis and also to be listened to by doctors, which seems to have also happened when we were talking about your celiacs as well, that doctors weren't really listening
Yeah.
there.
Well, I kind of went running for the celiac one because once I began to recognize the changes in my body were more like the people in my family with celiac, I'm like, yes, fine, I'll try it. It's not going to kill me to try it. And I found out just through that. I ran away from the fibromyalgia one though, because it's that the stigma. If your doctor tells you you have fibromyalgia, two things could be happening. One, they don't believe you, but they want to diagnose you with something so you'll go away. Or they don't know what you have and they know there's something wrong with you, but they can't find a test that says what is, so they diagnose you with that. Because my doctor, as he put it, it's to get diagnosed with fibromyalgia, it's a process of elimination. When you've been tested for everything else and there's nothing left, you have things like fibromyalgia. And as long as I continue to go in complaining about things that he recognizes from that list, he'll say, yeah, that's probably fibromyalgia. We don't need to worry about that. We just need to figure out a medication or a lifestyle thing for you to work with it. And in part, I agree. It's what I was doing my whole life. If you could manage a condition through lifestyle change, then it's easier than going through a bunch of medicines that could affect your body. And then maybe you get used to the medicine and then you have to change the medicine and then you have new problems. So I figure I'll control it until I can't. That was wrong. But because it's been looked at as a lazy disease, I didn't want it. I wanted to make my doctors test me for everything in the world first before they give me that, because I know how you get treated once you get it. Not great.
What do you mean by a lazy disease?
They call it a lazy disease for two reasons. It's either because your doctor is lazy and doesn't want to look for your actual condition, or your doctor thinks you are lazy because you keep saying you don't do anything and everything hurts and you have all these reasons to not live your life. And people around you in your community, if they see that you spend more time napping than reading, I don't know, just pick an activity. If you spend more time sitting down and vegging because it's all you can do, then maybe like that's how I've seen it. I've heard it in my family saying that, oh, well, it's not that bad. You're making it up. You're just being lazy. You just don't want to do something. And I'm like, that cannot be farther from the truth. Nobody likes that. I
I
mean,
think,
even if you don't
sorry.
want to do your chores, there's still something you want to do. So if you look at somebody who's doing nothing at all, it's because they literally can do nothing at all. If you look at somebody who goes jogging all day and doesn't clean their bathroom for 2 months, but they're jogging all day, that's like, they're not lazy, they're just different priority. That's distracted, that's busy. That's very different from sick.
I think that's the problem with like a lot of invisible illnesses is people don't take that into consideration that you don't actually see the physical effects on it on the outside of the body, right? Like even for
Yeah.
myself, I've had people discount the illnesses I have, even people in my own family, because they didn't see stuff. But then when they started seeing how I could not walk and I was crawling across the floor and experiencing some very bad symptoms where I was like extremely swollen, they were like, oh, this is real. But it shouldn't have to get to a point like that. I think there's just a lot of misinterpretations of what illness is, and even disability for that matter, which is a whole other topic. I think people are pretty close-minded and more eager to just label someone as lazy. Like I've had people tell me, "Oh, you're young, it's not that bad. I'm sure you're just, exaggerating it or whatever." And it's like, "No, why would I? Why would I exaggerate it? Like I'm trying to do things to protect myself, and part of that means resting." And some people, even in the chronic illness community, don't necessarily understand that because I have been hounded with messages before and then passive aggressive messages for that matter. Like, oh, you should talk to me right now. And it's like, I'm resting. Like, if I don't respond to you, it's not like I'm trying to fucking ghost you. I'm doing what's best for myself. So, yeah.
I got rid of a friend for not talking for me not talking to them when they wanted to talk. It was over something dumb. The context don't matter. I get a message and I send one back. I'm not feeling good. I need to do some resting. It's right around the time I got my fibromyalgia diagnosis, and this former friend worked in a medical community. So I don't feel good. I can talk to you about this later. Did not get the message. He just kept boop, 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 boop. And I'm like, all right, we're done.
Yeah, the boundaries need to be respected there, especially when you're dealing with chronic illness and you do have a lack of energy. And even if that person has chronic illness and says that they're understanding and is hounding you, or if they work in medicine, I think that's just terrible.
Oh yeah. I
Like,
think when
where's
you
the
don't have
respect?
boundaries and you work in the medical field, you should probably, I don't even know what the consequence for that should be. Like, you really need to know what boundaries are. Somebody shouldn't have to be sick for a boundary to be respected.
I think people have a harder time respecting boundaries when someone's sick because it's like, oh, you're home all the time. You don't do anything. So obviously you have all the time in the world to cater to my messages. And it's like, no, I do not. Like, first of all, I'm sick. I have appointments. I have lots of other things that I am doing. So yeah, that pisses me off. I don't know if you want to keep that part in here or not, or if you want me to cut that part out. Okay.
I think it goes to when you have new symptoms in your diseases, like brain fog was very new for me at that time. But I try to communicate with my friends when I start experiencing changes that impact how I talk with them. And if they don't understand that, then we usually just don't talk as much. But I've never had somebody just go so far into no, you have to speak with me right this second, right now. And I'm like, well, I'm not your child. I'm not your partner. I'm not somebody you work over. I'm a free agent person in another state, and it's past 10 o'clock at night, and I'm telling you my brain can't. And I think more people need to understand you should listen to your friends when they say they can't do something, even as simple as I can't talk right now. And what if they stay up to you or stay up with you until 3 in the morning talking every other day, and then this one time they can't? Maybe it's their illness. Maybe it's the thing they're searching for answers with their health about, because I'm still looking for fibromyalgia help. My best friend, whose wedding I just went to, she is one of the most awesome people because she knows what my limits are. She knows when I can't do something. She won't volunteer me to do something. She gets it. And when I was in her home, standing up, kind of standing like this half the time, she knew it's because her kids got cookies and they're going all over their living room and I can't touch the cookies. And so she's not offering me to hold her kids because she knows I can't touch her cookie covered children. She's respectful. And then I go up and down her staircase 5 times. I spent 3 days sleeping on and off after that. And she's like, how you doing? So sorry everything you went through put you through this way. I feel so bad about your flare. And I'm like, no, it's good. It was worth it. Now I'm going back to sleep. And she's like, all right, cool. And she'll just leave me a story to read when I wake up. And I love that about our friendship because she knows there's times when it's just going to be a lot of ouch and a lot of pain. And it doesn't mean anything when I don't answer. So she doesn't blow up my phone with, hey, why aren't you talking to me? Are you mad at me? Like, we don't have any of that weird, is something wrong stuff. And I'm grateful to her. So
It's
grateful.
important to have a friend like that because the understanding and the just the friendship in general that they offer you, like that's amazing. That's quite rare. And I'm really, really glad that you have someone like that in your life.
Are we getting close to the half-hour time?
I don't have the like time up. It is a 40-minute, I think, meeting. So it'll pop up when there's like 10 minutes left.
I'm remembering I'm bad with time management.
That's okay. That's okay. That's understandable.
Well, I'm looking at my notes of
Mm-hmm.
important things about fibromyalgia. And, we just touched on social life and friendships, doctors. I think, um, that if there's a cure or a treatment is worth talking about because right now we really only have drugs that your doctor can offer you, and some of them are very temporary. And if the doctor and pain management specialist isn't keeping up with it, then you get long-term issues with your medicine, like certain things that you shouldn't take for more than a year. People have been taking them for 10 years. And then some things, they call them off-label treatment because it doesn't, how do I say this right? When they went through the testing phase and they documented all of the conditions that this medication is approved to treat, that they got facts on if it treats it, then if it's not in that group, then it's off-label. So the gabapentin I'm on, I think it is a fibromyalgia drug, but it's also a seizure drug. And it's also a veterinary medicine. It has many different uses. So you can't call gabapentin a fibromyalgia drug, but you can say that people with fibromyalgia are helped by it in some situations. I think Lyrica is the first drug created specifically for fibromyalgia. I'm not on that one. I haven't tried it. And the people who get helped by it, great. But then there's a lot of people who don't get help. So when you have the beginning of a diagnosis and you're trying to find out what medication you're going to be given, the research for it is overwhelming. Your doctor probably already has a plan, but that plan has nothing to do with your body type. It has everything to do with what the market is currently saying works for your condition. So I heard gabapentin at every doctor's visit I went to before I accepted gabapentin because my doctor in his field, that's the hot drug for helping. Even though Lyrica was designed for us, according to the research they did, he wanted me to try something else. And I wanted to try everything but that because I had heard negative things about gabapentin, about excessive weight gain and not being able to then lose the weight. Like the 15 pounds that I just got back on my body, I'm lucky. There are people who have gabapentin in their lives in the first couple of months they're on it, they gain 20 pounds and then they gain another 20 pounds. And then they're 100 pounds more than they started. And they're like, I didn't ask for this. How do I manage this? I can't exercise this off. It's a hormone thing at this point, and maybe it'll help your pain condition, but the side effects it gives you might not be worth it, or they might increase health risks for other things. So I think I want for people to really be aware of that going into fibromyalgia diagnosis and people who know someone who have one. One of the reasons why our lives aren't getting together are because we don't have a cure or a treatment. You can't cure fibromyalgia. We don't even know what starts fibromyalgia. So all we can do is manage it. We manage that through low impact physical activity. I can't dance anymore because of it. And I was a dancer. I danced in heels on a stage, big lights in front of people. And I would dance for hours. And then when I wasn't dancing, I was on a bicycle. And when I wasn't on a bicycle, I was just up on my feet. That was my whole life until I was 25 and realized if I walk for 5 minutes, I'm going to lose a calorie and then I'm going to be 70 pounds. So I quit fitness until I could gain weight. Now that medication has put weight back on my bones, now I need the energy, and the fibromyalgia has taken away my energy. So if I want to go bicycling again, that hurts. That hurts worse than getting a hangover, climbing a tree, falling out of the tree, rolling down a hill, and then dragging yourself home. Like I wish that wasn't how I felt when I do the things I used to do on a regular basis. So if I walk right now, starting out 10 minutes. And I don't know how long I'm going to be stuck with only a 10-minute walk when I used to be able to dance for 4 hours straight. Like, big shock in how I do things I like doing when I have the little bit of energy to try to do them. So, friends, we miss you. We miss all of you. We miss all the things we used to do with you. It's just take the worst night you've ever had with the worst flu and then wake up the next morning and listen to yourself calling out to work or skipping class or just, you know, potato. That's us on a good day.
Yeah, I agree with you there. I do have a question about the gabapentin. What kind of relief does it give you?
So for me, it is telling the bruises that are not there that they're not there. Um, I don't have the bruise marks when it happens, which is how I know it's not a bumped into something bruise. So all those fake ouches, it tells that to go away. And I don't know what else it does because it's weird. I have a lot of other kind of comorbid things going on with sensory processing issues, which could be fibromyalgia. I don't know, but that's a whole category in its own. If it helps the sensory processing issues, then I appreciate it. But I'm trying to figure that out with my doctor right now, actually, because I was on 3 of them a day, and it didn't seem like it was helping. So he bumped me down to 2 a day. And then I started noticing things like my glasses are uncomfortable all the time. I just got new frames. These are my old frames because my new frames, they're irritating my head, my hair and clothing boundaries and everything. It's loud. The cat litter is loud. And I told my doctor and he's like, huh, well, I don't really know what to make of that. Make an appointment and come in and we'll talk about it. So on July 3rd, I go back to see if I need another gabapentin every day or if I have a new problem.
That's interesting. I have a problem with loud things. Like
Everything feels loud.
everything feels really loud. Like I can hear people walking upstairs. I can hear doors closing outside, even if I'm not close to a window.
Feel it? Do you
Yeah.
feel the noise?
Yeah.
Like
I feel it like hurts. So
there are
yeah,
days
that's
when
interesting.
yeah, there are
Sorry.
days when it does hurt, the sound, but even if it's not hurting, I feel it. So my neighbor is hammering something outside right now, and the air feels textured. That's the only way I can put it. But it's not attacking me, so I'm fine. But when I have a high sensory processing day, the sounds become painful because all of the sounds happening at the same time, it's just like you're shaking a silverware drawer, but you're in the silverware drawer, so you feel all of the metal pricking and poking amidst the noise. And it's hard for me to describe to someone who doesn't experience it. So thank you for understanding, but now I'm sorry you have to understand.
It's okay. I do understand it. It sucks, but I do understand it because I have had moments where I've been like, turn it down up there, and they're like, it's not that loud. I'm like, but it is. Like it is.
Yeah.
So that's why I try to wear headphones. I have like noise canceling headphones that I'll put on, and I won't listen to anything. I'll just put them on sometimes and just watch things with like closed captioning on
Do it.
because then it's like quiet. I really like quiet, so. Is there anything else you wanted to add about fibro and how it either affects you or things that you would like to say to people who have fibro or are pursuing the diagnosis? There's about 4.5 minutes left.
I would say if you're not diagnosed yet, pay attention to the things in your childhood that were not normal. Like, my feet hurt all the time. I was that kid you can't take to the mall because, gosh, her feet are hurting. She's no fun to take anywhere. Have you heard things like that before? Do you get chronic headaches and you've been to the eye doctor and you've been to the GP and nobody can tell you why you have headaches? Do you feel your clothes all the time? But you're otherwise, getting by, but no one else feels their socks the way you feel your socks. Those could be outside of regular, or not regular, but commonly known neurodivergence, where ADD, ADHD, autism spectrum family, there's a lot of sensory processing issues. If you know for certain you're not in any of those categories and you feel life the way no one can say they feel it, think about it. Because if you pair that with my feet hurt all the time, even though you're active, I feel like looking back, all my headaches, all my foot pains, they were trying to tell me something's coming. And I feel like I could have listened harder and said something to my doctor sooner because I'm about to be 38, trying new medications, and my body does not have the ability to just get over it anymore. Fibromyalgia, if this is what it is, was easier when I was 16 than 37. If that makes any sense at all, if you know what I'm talking about, like, I didn't wash my hair before this. I'm a mess because that would have worn me out. If that's your life, ask questions at your doctor.
That's some really good advice. Thank you very much. I appreciate that.
Thank you for listening.
Of course, I'm happy to listen. I learned so much. I learned so much when we talked about celiacs. I'm learning a lot about fibro. So I really appreciate you sharing because without you sharing, I probably wouldn't know as much as I know now. So thank you.
I want people to know all the things, learn all the stuff, share it. Let's get each other to help each other feel better or at least live with what we have.
Yeah, I agree. And being understanding and having someone that shares their story on the internet, I think also has more of a reach in that way because the internet is huge. So hopefully sharing this will help other people like you.
Hope so. I hope it'll help me too. I hope somebody will watch it and go, I know the cure, and then go and make the cure.
That'd be amazing. There was just a magic pill we could all take and it make everything go away. That'd be amazing.
Mother.
Well, thank you again for being on another episode, and this time we can have a proper closure of it because it's not going to cut us off for another minute. So thank you. And if there's more you'd like to share, or if people have questions for you, would you be willing to come back again?
Yes.
Okay. Excellent.
Yes.
All right. And we should maybe do another one talking about like the things that you do to help your celiacs, if you're up for that.
Yeah, that'll be a good break, and then we'll go over the next ones too.
Yeah. Yeah. We'll talk about it beforehand. All right. I'll let you go. Thank you.
Have a good day.
You as well. Happy resting.
Happy potato.
Thank you.
All right.
Bye.